Peace. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Neville Rodney. Peace, everyone. This is one. Welcome. Happy New Moon. Happy Friday. We're going to take our time. This is a level up. Brought to you by yours truly, the corner of YouTube where we read books and learn from masters in peace. I'm so honored I can bring this to you. Section 1. Foundations of Respiratory Care. One. Page 3. Pulmonary Anatomy and Physiology. Clinical medicine is predicated on the basic sciences of anatomy, pharmacology, physiology, and biochemistry. The following is an overview of the functional anatomy and physiology of the pulmonary system. It is not a definitive treatise, but rather a useful and up-to-date presentation of anatomy and function as related to respiratory care. The pulmonary system is separated into two major portions, the upper and lower airways. The upper airway is composed of the nose, the nasopharynx, oropharynx, oral cavity, the larynx, and the larynx. The lower airway is composed of the tracheobronchial tree and the lung parenchyma. The tracheobronchial tree is considered to be two distinct portions, the large and the small airways. Upper airway. The upper airway is composed of the nose, the mouth, and the pharynx. The larynx is the transition from the upper to lower airway. We shall consider the larynx to be anatomically the lower airway, but to have functions consistent with classification as part of the upper airway, among other factors. The upper airway, 1, acts as a conducting system for air to enter the lower airway. 2, acts as a protective mechanism to prevent foreign material from entering the pulmonary tree. 3, constitutes a considerable portion, 30 to 50% of the anatomic dead space. 4, acts as an air conditioner of the inspired gases. And 5, plays an important role in the processes of speech and smell. The nose. The nose is an organ that possesses skeletal rigidity. This rigidity serves to prevent collapse when a subatmospheric pressure is present during spontaneous inspiration. The nose has a small inlet and a large outlet and is shaped to produce an airflow pattern allowing maximum exposure of inhaled gas molecules with the muscular surface. The upper third of the nose is bony. The lower two-thirds is composed of cartilage. The nasal septum is cartilage in its anterior portion and divides the nose into two nasal fossae, whose lateral boundaries are the alae, figure 1-1. Although straight at birth, the nasal septum often becomes deviated in later life. The opening between the septum and the alae is called the nares, or nostril. The channel leading from the nares to the nasopharynx is called the choana. The anterior portion of the nasal cavity, the vestibule, is lined with skin and contains hair follicles, vibrissae, which are the first defense mechanisms of the pulmonary system. The major projections or turbinates arise from the lateral nasal walls. Airflow is separated into ribbon-like streams by these turbinates, allowing very close contact between the inspired air and the nasal mucosa. The nasal sinuses of the skull drain into the nose through openings which lie beneath the turbinates. The anterior third of the nose is lined with squamous, non-ciliated epithelium. Yes. The posterior two-thirds is covered with a ciliated pseudo-stratified epithelium containing many serous and mucous glands. The mucosal blood flow is very plush. Increased blood flow results in congestion and swelling, which may totally obstruct the nasal passages. Topical vasoconstrictors are extremely efficient in decreasing such congestion. The olfactory area is located in the region of the superior turbinates and is yellowish brown in color, in contrast to the pink color of the normal nasal mucosa. A sniffing action of the nose causes peripheral air currents to rise to the olfactory region, facilitating the smelling process. The sense of smell is poorly developed in man compared with other animals. Just a brief second, I know it's loaded. How's the feed? Peace, peace, highs, heart, love. Thank you for reading clinical application of respiratory care with us. This corner of YouTube, we read books and learn from masters. Thank you so much. I know it's heavy. That's why I'm going to give it in a little bit smaller doses, just like I did with the first book on this channel, in Civilization or Barbarism. This is the new book that we are reading. Thank you so much. Peace, highs, heart, love. Thank you for the likes and subs. We're pushing towards 500. This is a $3,500 book we are reading. Hardback edition. Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Published in 1979. This is the second edition. Master level reading. Thank you so much for being here. The internal and external carotid arteries provide arterial blood supply to the nose. Most of the venous drainage is via the anterior facial veins. A small portion of this venous drainage leads to the cavernous sinus. The lymphatic flow follows the general pattern of the venous drainage. The seventh cranial nerve provides the motor innervation to the muscles of the external nose. The mucosal sensory nerve supply is via the fifth cranial nerve. The primary functions of the nose are to humidify, heat, and filter the inspired air. Two significant secondary functions are the sense of smell and a resonance chamber for phonation. The copious capillary blood flow allows for transfer of heat to the inspired air. The copious mucus and serous secretions add as much as 1,000 milliliters of water per day to inspired air. The intimate contact between inspired air molecules and the nasal mucosa assures that the relative humidity of the inspired gas will be as high as 75 to 80% by the time the air reaches the nasopharynx. The filtering action of the nose is accomplished by the large hair follicles in the vestibule and the thick mucus layer covering the mucosa. This sticky substance tends to capture foreign particles in the inspired air and mobilize them toward the outlet of the nose. Thank you so much, Lona. Highest heart love. Peace. Thank you for being here. We are reading a masterful book. It is beautiful. Light and love to all my mods. Thank you for being here. Bottom of page 5. The pharynx. The pharynx is the space behind the oral and nasal cavities. See figure 1.1. It is subdivided into a nasopharynx, an oropharynx, and laryngopharynx. The nasopharynx is that portion that lies above the soft palate. The oropharynx is the portion from the soft palate to the base of the tongue. The laryngopharynx is that portion below the base of the tongue. The nasopharynx is lined with ciliated pseudostratified epithelium. The middle ear chamber is connected with the nasopharynx by a channel called the eustachian tube. The eustachian tubes have the function of maintaining proper air pressures in the middle ear. This allows the tympanic membranes to function properly. These tubes play a large role in the normal drainage of fluid from the middle ear. Nasopharyngeal inflammation can result in swelling and closure of these tubes, leading to middle ear disease, otis media, and hearing defects. The pharyngeal tonsils are located in the superior nasopharynx. This tonsillar tissue is called the adenoids, and in particular large in children. When enlarged, the adenoids may block the openings of the eustachian tubes and cause middle ear infections. The abundant lymphoid tissue located in the pharynx is an important defense mechanism of the pulmonary system. The oral pharynx extends from the soft palate to the base of the tongue. It receives air from the mouth and the nasopharynx and receives food from the oral cavity. The anterolateral borders of the oral pharynx contain lymphoid tissue called the fat focal tonsils, which may be extremely large in children. The focal tonsils are commonly referred to as the tonsils. The base of the tongue contains tissue called the lingual tonsils. The laryngopharynx extends from the base of the tongue to the opening of the esophagus. Important landmarks of the endotracheal intubation, such as the epiglottis, areoepiglottic folds, and the arytenoid cartilage, are contained within the laryngopharynx. The pharyngeal musculature is composed of complex layers whose motor innervation is the 10th cranial nerve, the vagus nerve. The sensory supply is via the ninth cranial nerve, the glossopharyngeal. The primary function of the pharyngeal musculature is to provide for the act of swallowing. The mucosa of the oropharynx and the laryngopharynx is composed of stratified squamous epithelium without cilia. Significant enlargement of pharyngeal lymphoid tissue can cause partial or complete airway obstruction. The base of the tongue can obstruct the airway by falling back to the posterior pharyngeal wall. The process of assuring that the base of the tongue does not touch the posterior pharynx is one of the cardinal maneuvers in establishing and maintaining a patient airway. Woo! Woo! This is so good. Hi, it's Heart Love. Thank you so much for being here and reading with us. Hi, it's Heart Love. Okay, moving on to page 7, and this is where we will pause for today. I'm so honored to be able to bring this to you. Thank you so much. Hi, it's Heart Love. All right, this is major understanding. How's it feel? Good? Oh, love. Thank you so much. Page 7, the top. The larynx. The larynx is the connection between the upper and lower airways. It ties in the anterior portion of the neck at the level of the fourth, fifth, and sixth cervical vertebrae. The opening to the larynx is called the glottis. Ding! Cartilages. The larynx is composed of a number of cartilages connected to one another by muscles and membranes. The major cartilage are the thyroid, the cricoid, the arytenoid, and the epiglottis. The largest laryngeal cartilage is the thyroid cartilage, commonly referred to as the Adam's apple. Is the thyroid cartilage, commonly referred to as the Adam's apple. It is more protuberant in males than females and consists of two flat sections that are joined together. Below, below the thyroid cartilage is the cricoid cartilage, an avascular structure that cry, cricothyroid membrane connects the thyroid and the cricoid cartilages. Since this cricoid thyroid membrane is below the level of the vocal cords, it is the site of choice for emergency surgical entrance into the lower airway, the cricoid thyroidotomy. The cricoid cartilage forms a complete ring, the only tracheal ring that is complete. The cricoid cartilage is the narrowest portion of the upper airway in the infant and small child. In the older child and adult, however, the glottic opening is the narrowest portion of the upper airway. The two arytenoid cartilages play a significant role in vocal cord movement. The vocal cords are composed of lig- ligamentous, ligamentous, and cartilaginous tissues that extend from the arytenoid cartilages to the thyroid cartilage. The laryngeal mucosa is composed of stratified squamous epithelium above the vocal cords and pseudo-stratified columnar epithelium below. Mucosa. Oh, thanks. She said you are so beautiful. Highest heart love. Gratitude. Thank you so much. We are almost complete page 7 of this new book reading. Thank you for being in peace with us in coordination. This is what we do in this corner of YouTube. Highest heart love. This is mucosa. All right. No cilia are present in the larynx. The sensory innervation to the anterior surface of the epiglottis is the ninth cranial nerve. The remainder of the innervation to the larynx is the 10th cranial nerve. That's the vagus nerve, the one we breathe through. The primary motor innervation of the larynx is in the 10th cranial nerve via the recurrent laryngeal nerve. That's where we'll pause. We're doing it. Heart love. Oh, thank you so much. I, oh, that's so beautiful. Highest heart love. Bonjour. Je m'appelle Uriel Neveu. Riley. Et tu? Bonjour, bonjour. Thank you so much. Much love. We're going to pause right here, the bottom of page 7, going into the epiglottis, and we'll pick up soon. Reading Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Thank you so much for being here live from the light. Peace, Marquise. Highest heart love. Happy Friday. We're doing it. I showed them. We manifested this. A $3,500 book. We did it. We did it. We're reading from it. I love you too. Speaking of that, thank you so much for the likes and subs. We're pushing to 500, shaking it up in the world. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. We're doing it. We are doing it. I knew we could. Thank you so much for being here in our sacred space. Thank you for the likes and subs. You know, we prayed for the best for each other here on this channel. That's what This is the peaceful part of YouTube, that we recognize one another and love on one another. And so I love you, honor you. Y'all have a wonderful day. I will start the playlist for clinical application and of respiratory care. I love you. Oh, peace, Coco. Thank you. Thank you, all my mods, keeping a chat, right? Oh my good, peace, love, and honor, everyone. Thank you so much. How's the feed? Thank you, guys. Oh, highest heart love. Feed good. All right. Oh, you are such beautiful people. I want you to have a wonderful Friday. It's new moon now, right? We channeled all of this. It's a time for releasing, renewing, being in peace, protecting our peace. I'm so grateful and thankful for all I have now and all that's coming to me. I love you. I have to. I give you a drink. Love water to all of you. This is that part of YouTube, right? We did it. No. 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 Get him out of here. I'm the antithesis of Donald. Look at me. Do I look like I like him? I'm the antithesis to that trash. I have class. I speak well. I read. I'm tall. I can fight. He can't fight. We don't deal with that trash whiteness. Bye-bye. I love you. No, we can't.